With more than 60 COVID-19 cases confirmed in the country, how are we dealing then with the spread when it comes to traveling and screening at numerous ports of entry and exit? Let me take you to eNCA's Lindokuhle Xulu, who joins me now live from Beit Bridge, border post between South Africa and Zimbabwe. And this is not, Lindo, one of the 35 land ports of entry and exit that have been shut temporarily for this period. At least it's not one of them, but it's a key hub because not only does it lead to Zimbabwe, it leads to a number of other countries as well. What are you seeing, what are you observing from the Beit Bridge border post?
Well, rightfully so, Tulas. The minister did say that, in fact, this is one of the entries in which it leads to many of the countries in the continent here in South Africa, and they did say that this is the only port of entry, the Beit Bridge, towards Zimbabwe. So they said that this one will not be closed. Of course, there are 35 of those that have been closed, because they said that they do not have the capacity to scan and the capacity to screen some of the people that would be making their way in and out. But most importantly, the minister did say that one of the things we need to take note of is the fact that this particular port of entry is one that is, as you would see some of the trucks behind me, a commercial one. So there is commercial activity taking place, and those 35 ones are ones that do not necessarily see a lot of activity. But we've been here for about 2 hours observing some of the activities that are taking place here, and I can tell you that it is functioning as normal. We did speak to some of the officials here who did say that one of the things that has been altered or changed at this point in time is the fact that before the officials here, your immigration officers, your home affairs officials, before they even interact with some of the people that are using this particular port of entry, the first people are the ones from the health department. There is a screening process as far as we understand, and thereafter, after they have confirmed that indeed someone can pass through and that they are not showing any vital signs of this coronavirus, then it's then that other officials are then interacting with them, doing due diligence in terms of some of the things that need to be checked before they go inside. But to us, as I told you, there is of course that movement here at the Beit Bridge, and one of the things that I have observed is the fact that as we had been observing for about 2 hours, there are trucks like this, which is one of the concerns that many people had in terms of when we close our borders, whether commercially it would be affected. But what we have been seeing is that the minister did say that one of the things he's not going to do is close some of those commercial ports of entry. So he did say that the 35 is closed down are ones that do not have commercial activity, and they're merely closing it for those who will be commuting and private cars. So the ones that are actually seeing commercial activity, such as the Beit Bridge here, are actually allowed to operate. But that screening, very much importantly, is being observed in all of those that remain open.
I'm wondering, Lindo, what the mood is then among the people that use that very busy port of entry and exit between South Africa and Zimbabwe. Of course, measures to control spread of infections and the likes and diseases are not new to that border post. I know for a fact that over a period of time, in a number of years, we've had instances where certain measures had been put in place, for instance, around foot and mouth disease, for example. But what are people telling you about their concerns, their understanding of some of the measures that have been put in place?
Well, you know what, Tulas, in fact, I did expect that since there is this coronavirus that has been trending, obviously on TV, obviously on other mediums of instruction, other mediums of communication, that there would be some of the alterations here. But in fact, what I can tell you is that it's a normal day as far as you can see. People are not even wearing gloves or even wearing masks. So, but the concern is not there, particularly because there hasn't been much of the cases that had been reported, both in Zimbabwe as well as in this particular province, as until today, of course, when we did learn that a doctor from the Limpopo province was found to also have tested positive to the coronavirus. But as things stand, Tulas, I can certainly tell you, people are standing around, even in groups, as I'll allow perhaps a gift to my colleague to just show you. People are in groups. There is no much concern that you see on the faces of some of these people. But of course, at a later stage, we will be trying to at least interact with those that are obviously will will be going inside to Zimbabwe, and those that will be coming from Zimbabwe, trying to observe as to what exactly are some of those screening processes that have been put in place, and also some of their concerns, if any. But at this point in time, it does seem like it's a normal day here. It does seem like there is a sense of calm and that no one is panicking at this point in time. But it is something that we will obviously be looking for in terms of interacting with them and understanding exactly what they go through with these new screening processes. But more importantly, the minister did say that one of the things they'll be doing is also boosting the staff here. They did say that they will be adding 20 to the 120 or so officials that are already here conducting some of this important work.
All right, Lindo, thank you so much. I see behind you there's a man who's really keen to be on national television, and I do see that he does seem to be keeping a good social distancing, a new concept that we are all getting used to. That's Lindokuhle Xulu. They're out for us there at Beit Bridge border post, one of the country's many land-based border posts. It remains opened.